Good evening, everyone. I warmly welcome you to our CellTalk webinar. In today's session, Ms. Ishita Narvekar will be presenting the paper titled Dietary Intake of Parkinson's Disease Patients. Ishita is a junior economist intern here at Renix. Her work involves collecting micro and macro data related to GDP, healthcare, etc., and analyzing that data for writing research papers for journal publications. She is currently pursuing her master's degree in economics from the Mumbai School of Economics and Public Policy. Prior to this, she worked for the International Institute of SDGs and Public Policy Research as a public policy intern. At Renix, she has not only gained experience in writing research papers, but has also built her confidence and managed time efficiently. So, without further ado, I now welcome Ishita to take the floor.
Thank you, Aditi, for the introduction. Good evening, everyone. The paper I'm going to present today is Dietary Intake of Parkinson's Disease Patients. Its authors are Franz Bart, Christophe Mathies, Andy Manners, Lemaitre, Gertrude Vlamenick, and Verily Fuller. So it was published in Frontiers in Nutrition on 24th of July 2020. Its impact factor is 6.01. Research by dietitians and allied health professionals. Parkinson's disease is the second most prevalent neurodegenerative disorder. Dietary management is often supplemented as an adjuvant theory. Thus, dietary studies may grant interesting insights into the diet of the Parkinson's disease patients and can help in reducing different symptoms, thus improving the patient's quality of life. In 2011, the British Dietetics Association, in partnership with the Parkinson's UK, devised a practice guideline for dietitians on management of Parkinson's disease, which emphasized on the importance of nutritional management in different stages of neurodegenerative disorder. There are some other studies that suggest a protective effect of intake of different vitamins and antioxidants, but it requires further. In addition, there are some other studies which propose a ketogenic diet. However, it lacks clinical data and risk of adverse events currently prevents the therapeutic use. So, in spite of the importance of nutritional management in Parkinson's disease, the information about dietary habits of the Parkinson patients is scarce. So, the objective of this study was to describe the nutrient intake of Belgian Parkinson patients and compare these intakes to the general nutrition recommendations. It also investigates their medication taking behavior and knowledge of potential food-drug interactions. So an observational cross study was conducted in which sample was recruited through their participation in cooking workshop. The inclusion criteria were self-reported diagnosis of Parkinson's disease and self-reported intake of any type of Parkinson's disease medication, which was later cross-checked by research team and the patient's physician. The record was needed to be completed during 2 non-consecutive days. Two non-consecutive days were decided because it is the minimum number of days required to properly estimate an individual's intake, and non-consecutive because food eaten on consecutive days may be related. The record included the dietary and timing of medication intake. The specific type of structure was mentioned in the morning, before noon, at noon, in the afternoon, in the evening, and evening. The general questionnaire comprised of MCQs about social demographic characteristics, changes in the diet and the underlying reason, knowledge about food interactions, and sources of information concerning food-drug interactions. For the determination of nutrient intake, the Belgian Food Composition Database was used. Based on actual intake, the usual dietary intake was calculated using the multiple source method. The multiple source method is a statistical analysis that allows the estimation of usual dietary intake based on two or more short-term measurements. The percentage of macronutrients of daily total energy intake was calculated using Atwater factors. Atwater factors are the value which are used to express the amount of energy that is available from a gram or any micronutrient. The micronutrient intake was compared with estimated average requirements, and the energy intake of participants was compared with the average requirements of men and women which were aged between 60 to 70 using physical activity levels. The normality of data was assessed using Shapiro-Wilk test, and if the data was not normally distributed, Mann-Whitney-U test was employed. The possible associations between categorical data of different socio-demographic characteristics were analyzed using Pearson's chi-square test, and a student's t-test was used to analyze the difference in nutrient intake according to gender. So in total, 52 men and 22 women aged 49 to 84 years were included. If the records received had incomplete data, or if there was non-compliance to the instructions to complete the record during two non-consecutive days, then such records were excluded. This table shows a detailed overview of the demographics of the study population. The mean age is 59 years, and the diagnosis was predominantly made by neurologists, and the financial majority of participants described the financial situation as averaged. The main type of education received by the participants were secondary and polytechnic, and majority of them received practical support from their environment. Most participants lived in multi-person household. This figure provides an overview of energy contribution per macronutrient for each eating occasion. If we take the mean daily energy intake, lunch and dinner supply the most of the energy. This table shows the result of the mean energy, macro and macronutrient intake in men and women compared with the nutrition recommendations. The result shows that the Parkinson disease population had a high dietary fiber intake, which is in line with the recommendations of the Belgian studies, and majority of patients had inadequate intake of vitamin D and iron. This table gives the main reasons for changing dietary habits of all participants. Amongst them, 55.4% noted a change in dietary habits since being diagnosed with Parkinson disease. However, 89% of them never consulted a disease-specific dietitians. The main reasons for changing the dietary habits are chewing and swallowing problems, constipation, and reduced sense of taste. This table gives an overview of medication intake and participants' knowledge and source of information of the food-drug interactions. The majority of the Parkinson disease patients claimed to be aware of the food-drug interaction between dietary proteins and levodopa. Levodopa is the most frequently used drug in the Parkinson disease medication. So a large part of the study population had inadequate intake of vitamin D, thiamine, zinc, and iron. There was no difference in the nutrient intake between men and women except for vitamin A and copper, and almost two-thirds of the participants claimed to be aware of the interactions between dietary proteins and levodopa. So to conclude, the monitoring dietary intake in Parkinson patients is important to detect possible micronutrient insufficiencies. The knowledge of patients regarding the importance of correct medication intake as well as the timing of the medication intake should also be improved. Patients should receive professional guidance in optimizing their diet to accommodate for different complaints inherent in the Parkinson disease patients. And this study has two limitations. The first one is participants in the study were recruited through cooking workshop. Therefore, they may have been characterized by greater interest in food and health and a higher adherence to a healthier diet compared to the other Parkinson patients. And the second one is dietary records may be subject to misreporting. So, the study provides evidence for dietitians and allied health professionals to direct their attention to the dietary pattern of Parkinson's patient so as to reduce the different symptoms and thus improving the patient's quality of life. Thank you for your patient listening.
Thank you so much, Ishita. That was an incredible presentation. It was so educational. I will now move the webinar to the audience, and I would open the floor for any questions or comments that they might have. So Vijay has a question. He asks, does nutritional supplementation or adequacy help in improving symptoms?
No, it helps in reducing the symptoms. Diet
I hope I
management.
hope that answers your question, Vijay. Nupur also has a question. She asks, did the authors report about protein intake
Protein intake?
one, protein intake one?
No, I'm not sure about that.
Ignore the protein one, just a typing error.
Oh, I'm really sorry. Did the authors report about the protein intake?
No.
Bharati has a question. She asks, what are the diagnostic criteria that they have taken to detect Parkinson's in this study?
It was a self-reporting ones. Like the inclusion criteria was the self-reporting diagnosis of the patients and self-reported intake of any type of medication. And it was later cross-checked by the research team with the patient's physician.
I hope that answers your question, Bharti. Numair has a question. He asks, how does this study help PD patients in planning their diet?
There are studies which suggest that the intake of different there are some studies which says that intake of different vitamins and antioxidants will help in reducing the intensity of the Parkinson's, or there are several such studies which need to be adjusted to the country's nutritional uh, guidelines, and that will help in reducing the uh, symptoms or the intensity of the disease.
I hope that answers your question, Numair. So I see no other questions in the chat box. Ishita, if I could request you to move to the last slide.
Yes.
So thank you so much, Ishita. That was truly an amazing talk. And thank you to the audience for your questions. So in closing this webinar, I would also like to inform the audience of the next Cell Talk webinar that will be held on the 20th of December 2022. And Mr. Abhijit Chavan will be presenting the paper Caste Differences in Hypertension Among Women in India, Diminishing Health Returns to Socioeconomic Status for Lower Caste Groups. Thank you so much again, everyone, for your presence today, and we hope to see you this time next week as well. Wishing you a great week ahead. Good night.